I'm Matt Willis, Public Health Officer with today's COVID-19 update. I'm going to provide a review of the situation at San Quentin State Prison. As of now, there are 1,135 confirmed cases among people who are incarcerated and another 100 among staff. That's about 1/3 of all people incarcerated at San Quentin, and the numbers keep rising. 11 people from San Quentin are in Marin hospitals, of which 8 are in ICU. About 10 individuals are transferred from the prison daily for hospitalization. Observing this outbreak as it has accelerated over the past month from the margins has been one of the most challenging and frustrating experiences in my public health career. Marin Public Health has no authority to influence the response on site, outside of providing advice. The small and very dedicated team of doctors and nurses at the prison are trying to keep up with rising numbers and are increasingly overwhelmed. I'm relieved to say that this morning there was a Senate hearing in Sacramento that raised the alarm we've been sounding for weeks. To recap briefly, on June 1st, we were notified that 120 men had been transferred from a prison in Southern California to San Quentin. Up to that point, there had been no cases at San Quentin, but the other facility was experiencing a COVID-19 outbreak, and the transfer was to reduce the population at that facility. Most transferred individuals had not been recently tested before transfer. Knowing that some would be infected through exposure in Chino, we recommended testing all of the transferred people and sequestering them completely from other San Quentin inmates. Instead, they were placed in a large, shared unit with the existing San Quentin population prior to the return of their testing results. Because this had placed both the people currently incarcerated and staff working in that unit at risk, we recommended a policy of mandatory mask wearing and a requirement that staff working in that unit not roam to other units. We were reminded by state corrections that local health officers lack the authority to mandate such measures in state-run prisons. Seeing the consequences of decisions made that far, on June 3rd, we recommended San Quentin leadership establish an incident commander who had expertise in outbreak management to run the operation at that facility. This was not done. And on June 16th, our Board of Supervisors sent a letter to the governor and state leadership outlining our recommendation for 2 things. First, a single incident command with facility-wide view to manage this increasingly complex and fast-moving outbreak. And 2, increased on-site medical capacity to care for the ill. This letter echoed one that Assemblymember Mark Levine had sent 1 month earlier, before any cases, when we signaled to him our concern that we had not been able to secure a plan from the prison for how they would prevent and manage a COVID-19 outbreak. The good news is that the sum of these efforts and our collective advocacy has yielded the strong state-level support we've needed. Tomorrow, I've been invited to join an incident management team led by state disaster response agencies. This is now being viewed and responded to as a disaster, and that will bring new resources and tools. I'm grateful to our community hospitals for stepping up and rising to this challenge, and to our elected leaders for raising this issue and sticking with it. The solutions built here, while late, will hopefully allow more timely response to the next prison outbreak, wherever that might occur, and can guide how the health of people who are in prison should be safeguarded all the time. As 4th of July is coming, please be thoughtful in how you use your freedom. This Independence Day is about our interdependence, fighting COVID-19. This outbreak shows us how quickly this disease can spread. Please do your part to stop preventable surges in cases from July 4th gatherings by staying in your protected, smaller groups, outside, covering your face, and staying 6 feet apart.